Coming to the circular epithelium. These lines the gingival sulcus. They are thin, non-keratinized, stratified squamous epithelium without red apex. Extends from the coronal limit of the junctional epithelium to the crest of the gingival margin. It lacks granulosum and stratum corneum layers and also K1, K2 and K10 to K12 cytokeratins. They do not contain any Merkel cells. It contains K4 and K13 esophageal type cytokeratins and also express K19 cytokeratin. Their lack of keratinization makes this area particularly susceptible to influences from microorganisms. Coming to junctional epithelium. It consists of collar-like band of stratified squamous non-keratinizing epithelium, which is important component of innate immune mechanism. In early life, they will be of 3 to 4 layers thick. Then it increases to 10 or even 20 layers, which has a length of 0.97 mm. They are classified into coronal cells that are tightly adherent, allow diffusion of the gingival clavicular fluid into the sulcus. Then middle, the most important for adhesion to tooth, and then apical, which is involved in the rapid proliferation. The cells can be grouped in two strata, the basal cell layer and suprabasal layer. The basal layer, which is facing the connective tissue, and suprabasal layer extending to the tooth surface. It consists of two basal lamina as shown in the figure. The internal basal lamina, which is the junctional epithelium to the tooth surface, that is the epithelium attachment. Then the external basal lamina, which connects junctional epithelium to the connective tissue, that is the connective tissue attachment. You can see that clearly in the figure. Coming to the endogingival unit. It is a functional unit composed of the epithelial attachment and connective tissue attachment of the gingiva. What is a gingival unit? Gingival junction current concept. According to Gottlieb in 1921, he first coined the term junctional epithelium and he termed it as an epithelial. He termed the endogingival junction as an epithelial attachment. In Orbens in 1953 stated that the separation of the epithelial attachment cells from the tooth surface involved preparatory regenerative changes in the epithelium. Coming to the epithelium connective tissue interface. This is the boundary where the epithelial tissue meets with connective tissue. It has deep extensions of epithelium that reach down into the connective tissue that are called as the epithelial ridges or red apex. There are finger-like extensions of connective tissue that extend up into the epithelium, which are called as the connective tissue papillae. Coming to the external basal lamina. It anchors the junctional epithelium to the underlying connective tissue, consisting of lamina densa, which towards the underlying connective tissue and contains type 4 collagen. Then lamina lucida, which is against the basal keratinocytes of the epithelium and contains laminin. Coming to gingival connective tissue, the major components are collagen fibers, which constitute the 60% of the components, and then fibroblast, vessels, nerves and the matrix. It has two layers, papillary layer and reticular layer, consisting of two compartments, cellular and extracellular. The cellular components are fibroblasts, mast cells, macrophages and inflammatory cells. The extracellular components are fibers and the ground substance. Fibers include collagen, oxytocin, reticulin and elastin. In gingiva, the collagen fibers are arranged in bundles called gingival fibers. So, what is the function of these gingival fibers? It is to brace the marginal gingiva firmly against the tooth to withstand the forces of mastication without being deflected away from the tooth, to unite the marginal gingiva with cementum of the root and the adjacent attached gingiva. Coming to the gingival fibers, there are principal fibers and secondary fibers. The principal fibers are dentogingival fibers, alveolo-gingival fibers, dentoperiosteal fibers, transeptal fibers and circular fibers. The secondary fibers include periosteogingival, interpapillary, transgingival, intercircular, intergingival and semicircular fibers. Coming to the dentogingival fibers, they are present in facial, lingual and interproximal surfaces which is embedded in the cementum near the cemento-enamel junction. They are fan-like conformation towards the crest and outer surface of the marginal gingiva. Interproximally, they are seen with the crest of the interdental gingiva. They functions by providing gingival support. To alveolar gingival fibers, they are from the periosteum of the alveolar crest which spreads coronally into the lamina propria. They function by attaching the gingiva to the bone as said by its name. Coming to circular fibers, they are present in the marginal and interdental gingiva which encircles the tooth in a ring-like fashion, functions by maintaining the contour and position of the free marginal gingiva. To dentoperiosteal fibers, they originate from the cementum near the CEJ and insert into the periosteum of the alveolar crest and attaches tooth to the bone and protect the PDL. Transeptal fibers, they are originate from the interproximal cementum coronal to alveolar crest. It courses from mesially and distally in interdental area into the cementum of adjacent tooth which functions by maintaining the relationship of adjacent teeth and protecting the interproximal bone. The reticulin fibers, which are numerous in the tissue adjacent to the basement membrane and also present at the epithelium connective tissue and endothelium connective tissue interfaces. Oxytalin fibers are mainly parallel to the long axis of the tooth and insert into the cementum. It is elastic in nature and are largely associated with blood vessels. They functions by mechanotransduction. Elastin fibers seen in the connective tissue of the gingiva and periodontal ligament which is associated with the blood vessels. Coming to the ground substances. These fill spaces between the fibers and cells which are high in water content and composed of proteoglycans and glycoproteins. Coming to the blood supply of the gingiva, there are three sources of blood supply to the gingiva, that is supraperiosteal arterioles, vessels of the periodontal ligament, arterioles from the crest of the interdental septa. Coming to nerve supply, all the nerves supplying the gingival mucosa originate from the mandibular and maxillary branches of the trigeminal nerve. Coming to the mandible, the labial part, that is the buccal branch of mandibular nerve and incisive branch of mental nerve supplies to the labial part and lingual nerve supplies the lingual part. Coming to maxilla, the labial part is supplied by posterior middle and anterior superior alveolar nerve. Coming to the palatal part, they are supplied by greater palatine and nasopalatine. Mandibular incisor area is drained into the submental lymph nodes, while the maxillary palatal gingiva is drained into the deep cervical lymph nodes. The buccal gingiva of maxilla and buccal and lingual gingiva in mandibular premolar area are drained into the submandibular lymph nodes. Coming to the clinical features of gingiva. Gingiva is brown or orange to pink in color, which is result from the vascular supply, thickness and degree of keratinization of epithelium and the pigment containing cells such as melanocytes. Coming to the size, the sum total of the bulk of cellular and intercellular elements and their vascular supply. Contour, the marginal gingiva which envelops the teeth in a collar-like fashion is scalloped and knife-edged, while the interdental papilla is pyramidal in the anterior region and tent-shaped in the posterior region. Its shape also depends on the shape of the teeth, alignment in the arch, location and size of the area of proximal contact, dimension of facial and lingual gingival embrasures. To the shape of the gingiva, the interdental gingiva shape is governed by contour of the proximal tooth surfaces, location and shape of the gingival embrasure. The proximal surfaces of the crowns are relatively flat facial-lingually. Interdental gingiva narrow mesiodistally. The proximal surfaces that flare away from the area of contact, interdental gingiva is broad and mesiodistally. Coming to the consistency, the gingiva is firm and resilient because the collagenous nature of the lamina propria and the continuity with the mucoperiosteum of the alveolar bone, the gingival fibers contribute to the firmness of the gingival margin. Coming to the surface texture, the textured surface similar to an orange peel that is referred to as stippling of the gingiva. It is best viewed by drying the gingiva. The attached gingiva is tipped while the margin gingiva is not. Due to attachment of gingival fibers to underlying bone is the reason for stippling. Microscopically, it is produced by alternate rounded protuberances and depressions in the gingival surface. Stippling is a form of adaptive specialization or reinforcement of function, and stippling will be absent in diseased conditions or inflammations. Coming to position, the gingiva is at the level which gingival margin is attached to the tooth. When tooth erupts into the oral cavity, the margin and sulcus are at the tip of the crown. As eruption progresses, they are seen closer to the root. Coming to the conclusion, the gingival tissues play a key role in the protection of tooth structures and supporting periodontal tissues against trauma or infection, making gingival health a very essential component for the success of all periodontal treatment procedures is very important. Thank you.